Since we're talking about male infertility,
The first problem arises with acceptance.
People are not ready to share. One is like fertility issues.
It's not like a female where we have to go and check the equality.
Which is chemicals in the environment is also higher than ever before.
I think usage of genes and things like that, especially when they are actually planning, can be cut down.
He's not able to make his wife pregnant.
Hello and welcome to Path to Parenthood, our second episode of the podcast series. I am Archana Ravikumar. So today we have all gathered to talk about a very important topic which often goes undiscussed, that is male infertility. It is undiscussed because a lot of taboos and myths are associated with it. Today, let's break the ice and know more about male infertility, the factors which influence male infertility, the causes, the solutions to it, and the role of nutrition and all that in today's discussion. Whenever we talk about infertility, it is always about women. But did you know male infertility too exists? But it often goes undiscussed as it is a taboo talking about it. Today, we are all sitting here to discuss about male infertility. Let's break the ice and know what is male infertility and what are the factors that are affecting male infertility and what are the solutions and the role of nutrition. Let's continue our show. Today we have four special guests with us. Let's welcome them. Dr. Shashidhar, an andrologist from Andro Plus. Welcome, doctor. And Dr. Archana Karthik, a gynecologist from Womb Care Fertility. And Dr. Sushma, a psychologist. And Roshni Sangvi, a wellness expert. A warm welcome to the show.
Thank you so much, Archana.
Since we're talking about male infertility, let's have Dr. Archana talk about it. Doctor, why is it so important to talk about male infertility?
See, male infertility, as I told you, the incidence is coming up day by day. It's like 40 to 50% cases nowadays, equally as important as a female infertility. The definition for male infertility is that a man is failing in conceiving his women even after trying for an year. So, he is not able to make his wife pregnant for 1 year. And then issues could be mainly, initially it can be even erectile dysfunctions, or there may be some ejaculatory dysfunctions, or maybe sperm quality issues. Quality issues can be even count, motility, morphology means the shape of the sperm can be abnormal. There is something called DNA fragmentation index nowadays, that means damaged DNAs are more in male, especially because of mobile and computer usage, the laptop usage. So, these are coming up nowadays very frequently. So, male infertility is one of the leading causes. That is why it is very important to discuss about it.
So, how do we identify, doctor? Are there any specific changes or symptoms that can tell that a male is not productive enough? How do we identify that?
See, unless it is an erectile dysfunction or an ejaculatory dysfunction, that is inability to ejaculate the sperm inside the vagina, these are the main symptoms. Otherwise, usually it is asymptomatic. Only when we evaluate that they are not conceiving for 1 year even after trying regularly, and then when we check their sperm quality, there may be issues. Otherwise, usually they are asymptomatic. That is why it is very difficult to say, but instead of that, if they meet a doctor very early, maybe 1 year after they try, immediately if they go and get their sperm analysis or semen analysis, it will be easy for them to go ahead with early treatment.
Okay, but generally men don't open up about it at all. What are the taboos that exist and how do you overcome that, doctor?
See, especially in India, it's like it's labeled for a woman that pregnancy is women, fertility is women. Men are not responsible for that. And they think if the man is not able to make his wife pregnant, that means he is not a man. So, that makes a male to get embarrassed to come up and say that he has some infertility issues. And there is a taboo also that people think, oh, what do they think about me, that I am not, means his ability is judged there. So, that is the reason usually they don't come up with. I have seen many patients who come to my clinic who just send their wives saying that infertility, you go and get the treatment, and they don't even walk to the clinic sometimes. So, nowadays it is very important to educate both of them.
Yes, doctor, as Dr. Archana mentioned, there's a lot of emotional stigma attached to it and a lot of taboos. It is not masculine if a person comes out and says he has some problems with it. How do you address this, and why is it important that people open up and talk about it?
Very good question, because like doctor mentioned, it's a taboo subject. No one wants to talk about it, and the first problem arises with acceptance. See, they need to accept that okay, there's a problem, then we can go to find a solution. But when that acceptance itself becomes a problem, it leads to a cascade of events which leads to a lot of negative emotions. Stress, anxiety, depression, isolation, aggressive behavior also, where they want to assert their masculinity, saying that, you know what, I am the powerful one, I am in control. So a lot of aggression, power play, so many things comes in. But the one tiny thing that they forget is it is just a part of life, but that's not life. And there are so many things that surrounds that which can be taken care of. So we ask families, we reach out to families where we can talk about it, not just to the male involved, but to the entire family, because he's not alone in this. See, there could be so many taunts from family members, from the society, why the spouse can also be talking, the parents, the siblings, there's so many things. So we stress upon family therapy. We talk to the spouse together, we talk to them alone, we talk to the male, so that this can be managed and a healthy lifestyle can be achieved, knowing that it's a part of life, but it is not life. When this sets in, life becomes a bit easier to manage.
So basically you're saying barriers have to be broken,
Yes.
and there's a lot of emotional support from the family
Yes.
itself.
I would like to add a couple of points for that. I agree with Shushma. Acceptance, something we are seeing a change when it comes to accepting the subfertility problems to such an extent that I get to see patients even before marriage. They're engaged to be married. They come with doctor, I'm getting married in probably next 1 month or 2 months or 3 months. I want to ensure that I am fit both on the fertility aspects
Yes.
and also on the sexual aspects. Yesterday I saw a patient, his marriage is on Friday, that is tomorrow, and he came yesterday for a Doppler evaluations. So they become so proactive that they are willing to research to see where I can find specialist, or probably where I can get an advice. And yes, even in male infertility also, people, yes, there are two things which people are not ready to share. One is like fertility issues and also the sexual problems. They somehow are they're taken back, they don't open themselves, they are inhibited to disclose. But because of the availability of a lot of online platforms which can guide them where to go, I am getting, believe it or not, maybe 60 to 70% of my patients, they have come to me doing research alone. Even they are so proactive, they come before marriage to get themselves evaluated. So as people are becoming more knowledgeable and educated, it's also a route for them to seek the approach in the right manner. So nowadays people are very much open, they become so proactive, they are very much open to accept that they are subfertile and seek treatment. So that's something which is very welcoming. So I don't think so that taboo and all is still prevailing, but especially in urban and cosmopolitan areas, people are not really into those, and they are coming very openly, they are taking treatment without any inhibition, and that's something which is very encouraging, I would say.
Agree.
Yeah, which is
Yeah.
a very good development too,
Yeah, very much,
actually.
very good.
Right. To open up itself is a nice thing, and being proactive is even more better. You're already you already know where the problem is, and you actually work on it much before the problem arises.
Definitely.
Yes, doctor. So, Dr. Shashi, can you tell us about the different reasons behind this issue?
That's a very good question, Archana. We should really know about the male infertility, because that's one thing which you are missing out on a day-to-day basis on a clinical examinations. Surprisingly, we have seen that the percentage of male infertility has almost doubled, I would say. Maybe we would say a decade before, where the fertility ratios were 30%, both male and female were contributing. Now we see that in an exponential way, the fertility male fertility percentage of a male has increased. It is now standing at around 60 to 70%. And definitely, because now we are seeing more and more of faults in the male factors than the female factors, which has remained a constant throughout the whole, in the past. And there may be very different reasons. We tend to categorize into two ways. We need to see, is it because of the inherent problem within the testicles or a problem outside the testicles. Within the testicles, it may be genetic, where sometimes these people are born with inactive germ cells which have lost the potential to produce sperms, because germ cells are like small cells which grow and mature to mature sperms, which is absent in them. Secondly, it may be because of other conditions like Klinefelter syndrome, where these people are born with malformed testicles or undeveloped testicles. Thirdly, people who are exposed to childhood cancerous treatment like chemotherapeutic agents, where it damages the germ cells, and they can also end up with the testicular infertility. Of course, more than these are the small part of causes. Other major important causes would be where extra testicular causes, which is the second point, where it can be because of a lot of infections, especially sexual transmitted infections. It can be because of blockages due to developmental problems, and we need to see at what level the fertility can be evaluated. More importantly, apart from the testicles, we have also been able to diagnose the hormonal causes. We say hormones are like a managers in a factory, where if the manager is not working properly, workers may not work properly. So hormones are like managers which are produced by the brain, and they control the testes to produce normal hormones and the normal sperm productions. So it's very important for us to, at the end of the day, to diagnose as to at what level the fertility may be. It may be testicular, it may be extra testicular, or it may be even hormonal also.
And now, since you said about 60 to 70% of percentage is increased in male infertility. Now, doctor, once a man identifies that he is infertile in some way, how do they approach a doctor, or rather what are the steps they can take before they approach the doctor?
So now we need to be very specific about how does a man identify himself as infertile. I always tell my patients that nobody is infertile, because that's how the nature comes. We've always believed that a reasonably well-built person with a reasonable knowledge and has a reasonable capacity, or is it presumed that he can have a reasonable fertility chances. So nobody will come to know that you are infertile or subfertile before marriage. Subfertility is always a post-marriage diagnosis, and that will come to know when couples have tried for sufficient amount of time, and when they don't conceive, of course they go to a doctor, and of course we do all the tests, and they come to know that they are infertile. But yes, certain our lifestyle factors can predispose us to develop infertility, because in this today's day of so hush and rush everywhere going around, we need to really see that how much we are keeping up our health, which favors the fertility. Probably being it our healthy lifestyles, being it our eating habits, being it our sleeping habits, stress levels. All these things should be considered in the thing. And once you embark on a fertility journey, it's very much important for us. These are all the other auxiliary factors, where when we are healthy in these factors, we can expect a good fertility outcome. So it's very much important for us to maintain a healthy lifestyles in every aspect for that matter, so that we can expect a good results when you try to conceive. That's very important for us.
Dr. Sushma, about male infertility, there is a lot of stigma attached to it, and people generally don't open up about male infertility. How do you encourage your patients to talk about it, and how do you bring down the emotional stress and the emotional turmoil they undergo?
Agreed. So when we look at our entire population, men have a traditional role to play. So they are the providers, they are the caretakers, they are the protectors, and it is seen that they are entitled to bring about the next generation. So when that is being stopped, or when they are not able to do that, there is a sense of inadequacy, and it's also a control. It's a role of power, and there's a lot of, when all these main positive things are being curtailed, what happens is this leads to a lot of stress, anxiety, and a feeling of inadequacy, where they feel they are losing control, power, and they start looking at themselves as someone a bit low, because they're not able to do the provision part that they are supposed to do. And sometimes this comes out in various aspects. Either they isolate, or they pull back completely, or they lash out. So there are two extremes of both. And generally we see that the women earlier also, like doctor mentioned, they used to identify that in women, because many men would not come for even getting tested. But now we are seeing a lot of change, and men are also coming forward, but they don't have the support group when they see that okay, something is not right. So, and who do they go and talk to? Because some of us also come with the bias that okay, they are supposed to, they are the providers, they are the ones, they are the backbone of the family. So at this time, the first thing that should be taken care is the family system has to come together really strong. There is no shaming, there is no guilt, but it is trying to understand what is the next step. If this entire thing is the life, it's just a part of it. You don't have to look at life as a whole. So probably you can have support centers, counseling groups, family therapies can be given, and different helplines can be arranged so that they can talk. Because this, if it is not being connected to, it is not just one individual who is getting affected, but it is the entire family, and it percolates to the society also. So it is better that when they come for all these treatments, that we have someone to talk to them, connect to them, help understand, and first of all, the spousal relationship has to be really strong. So the partners have to stand for each other. So when we look at all these, the negative emotions will be taken care of.
And now, since we've already spoken about male infertility, Dr. Archana, can you shed light on what they can expect from the first visit to their doctor?
See, as they come to me for the first visit, any urologist or a gynecologist or an infertility specialist, usually we take their history first. And based on the history, we'll come to some kind of diagnosis, what is their major issue, whether it is male or female issues. And then we come to examination part of it. I simultaneously examine both of them. And then once the examination leads to some kind of issues or some indication that this is a problem with that person, directed investigations we do. But the basic investigation, the simplest one is semen analysis. So that doesn't require any invasive procedures, and it's not like a female where we have to go and check the equality. For that it's a big procedure. It's not like that in a male infertility. So we directly ask them a few blood tests, preliminary blood tests, and then ask them to give a ejaculatory semen for examination with an abstinence period of 48 to 72 hours. So that is the basic first visit things what we do in a clinic.
Okay. Okay, Dr. Shashi, how do you figure out what is happening in male infertility?
Yeah, my approach is very simple. One is like, whenever the patient comes to you, first thing is like reassurance is very important, it's reversible. Sperm count is something which is very much dynamic. Patients come with either with a sperm count which they are very afraid and scared. Doctor, my sperm count is so low, or yet to know their diagnosis. So we should reassure them that sperm count is very dynamic. Today it may be 50 million. Next month it might jump to 100 million. It's very dynamic. So reassurance probably solves most of your problem. Second thing is like, if they are now there's a trend that we are embarking on a baby doctor. I mean, we just married around 3 months, 4 months back. We want to get on to a baby doctor. I want to see everything is fine. As I told you previously, it's presumed that a reasonable looking couple have a reasonable ability to conceive naturally. So if they are well within that range, I tell them, don't worry, I don't do any investigations, just go chill for one year, you try, naturally it doesn't come, then come to a doctor. Otherwise, I don't go proactively doing all exhausting investigations. But yes, when they have exhausted 1.5 years of, because the chance of conceiving naturally within 1 year of trying is around 80%, which increases to 90% in the second year. So it's very important for them, to give them the right amount of information. But yes, if a patient comes to us because they have been tried for last 1.5 or 2 years not conceiving, the simple thing is like just do a semen analysis very much. There can be two outcomes. If the semen is normal, reassure them, just go and try out. Also parallelly also try to evaluate the female factor, because it's a teamwork. If the both male and female are on the optimum health factors, conception happens. If the female is on the higher factors, the male is low, female can compensate, and vice versa. It's very much important. So, but yes, both the partners should be equally evaluated in the same aggressive way. What I usually advise them to go for semen parameters. Let them come with the semen parameters. I look for the count. I will look for how the sperms are moving. I look for any abnormal or any damaged sperms. If I see any abnormalities, then probably I do the next level evaluation. That is, probably I want to do some hormone evaluations which I control the overall sperm production. I will also look into the testicles proper. I probably will do something called a testicular or a ultrasound or a scrotal Doppler to see any conditions like popped up veins which can cause a varicocele, or any infection, or any kind of discrepancy or shrunken testicles, or any water collection, because all these testicular factors can also contribute to abnormal sperm parameters. So it's always we do a level or systematic evaluations to come to a diagnosis. So I would simple this, first to do a semen analysis. If everything is fine, just reassure them. If it's abnormal, then you subject them to for further investigations.
The lot of factors actually influence male infertility. Roshni, could you shed light on how lifestyle changes also impact male infertility?
So we are living in a hyper-stimulated and hyper-connected environment. The way we are stimulated right now and connected, even with regard to technology, it's more than ever before. Our exposure to something called endocrine disruptors, which is chemicals in the environment, is also higher than ever before. And all of these factors play a role with regard to fertility. Now, when we talk about lifestyle, lifestyle is everything from the time you wake up to the time you go to sleep. How are you living? That is your lifestyle. And wake up is important, which is your circadian cycle. Now, let's say someone's sleep cycle is not well, they are not getting enough restorative sleep. That itself is a reason enough, because it's not supporting biologically. If you're looking at, it's not supporting an environment for fertility.
I think that's the main problem. People hardly sleep these days.
People hardly sleep, and even if they are sleeping, they are sleeping too late in the night. They are waking up late in the morning. You're missing the sunlight exposure in the morning. You're missing the sunset exposure in the evening. We are inside more. Besides this, your gut health plays a huge role. The kind of things which you're putting into your mouth, through your skin, skincare products, all of these can influence your gut health, and that can be a cause itself. Of course, there's alcoholism, recreational drugs, hookahs, shishas. I've had clients in the past where this is just normal. It's a part of every evening. It's just the inability to reduce your stress without a recreational drug is very, very normal. And these are all influential factors when it comes to lifestyle modification and lifestyle management. I think care should be taken with regard to understanding what aspects are you willing to change. Willingness to change is important, versus which ones are you not willing to compromise, because we are living in a society, you're not living on an island. So everything you want your way might not happen. If your partner is someone who's working late and who's awake at late in the night, you might not be able to sleep on time. Or these factors need to be considered, but lifestyle plays a huge aspect when it comes to fertility management.
I think it's quite a challenge also these days, because they're so influenced by their peers that they just want to go try, and they get addicted and things like that. Now, Dr. Archana, can you just explain about the environmental factors that influence male fertility?
Yeah, nowadays the environment, we all know it is not under control now. So environmental toxins, from the factories, we have pollutants which are coming up. They are led into our sea and our rivers. So whatever the water we drink, the vegetables what we eat, it's full of chemicals, and heavy metals are there in so many things what we consume. So there are a lot of toxins which we are eating day by day, and we are drinking also. The water is not safe. The plastic containers what we use, especially drinking water, and stored containers where we eat food. There again, the plastic is entering our body. The whatever she said about the daycare products, what we use, our makeup and all that, that is adding on chemicals to our body. So that itself indirectly affects the hormonal changes in our body. Along with that, our mobile radiations, laptop radiations, and also the heat, the dress what we use, what we wear, the tight jeans what we wear, where there is no aeration at all. And the temperature is very high in genital area where it is supposed to be aerated very well. And over that, when they use hot water baths, sauna baths, all this will add on to the sperm quality deterioration. It's not just sperm, even the oocyte quality also comes down because of this kind of things, which is so many things are unavoidable nowadays.
I think usage of jeans and things like that, especially when they are actually planning, can be cut down.
Definitely. And even the plastic containers what you use, we can reduce using it by taking care of using steel bottles or something, replacing everything with our own individual things.
So Dr. Shashi, can you explain about the genetical conditions and the other conditions which influence male infertility?
So whenever we try to evaluate male infertility, we have seen that it is categorized into where we can attribute certain reasons for causing infertility, and certain reasons where we don't know the reasons called as unexplained or unknown etiology. So yes, we try to see for those correctable factors, especially it can be hormonal imbalance, it can be infections, it can be any issues within the testicles like a popped up veins or infections or water collections, or it may be genetic factors. Yes, we have seen that whenever a patient comes to us, the paramount is to analyze as to in what level he is having a problem. If we do, especially in hormonal imbalance, more predominantly we do some hormones which are critical for a normal sperm productions. And we do a scan, like we also seen that varicose also plays an important role in causing male infertility, but not always the cause. If I pull around 10 males and do a scan, at least 5-6 will have a varicocele. Doesn't mean that everybody should be operated, because varicocele doesn't have any medical management. So always our endeavor is to treat the problems, easily solvable problem, which is the hormonal imbalance. We try to treat the hormonal imbalance, and in most of the cases, 80 to 90% of cases, the sperm parameter reverses to a normal stage. If it doesn't return back or reverse back, then we shift over to the surgical aspect called as surgical optimizations. Certain genetic conditions like Klinefelter syndromes where or any previously history of mumps orchids where they come with zero sperms in the ejaculate. They feel that they are having, doctor, whenever I have intercourse, I have a normal semen coming out, but sperms are like fish in a water. It's like you have a pond, but there are no fishes. But if he believes that he has a lot of fishes or sperms, but these conditions where you see he is ejaculating, but there are no sperms, especially Klinefelter syndrome, there are something called as genetic problems like microsomes deletions or mumps orchids, or any infection in the past can also cause azoospermia. In those cases, sometimes we have seen
Sorry
that.
to interrupt, doctor. Infections as in?
Yeah, like any bacterial infections can also cause infertility in some cases. We have seen that. Even a simple fever can knock down your sperm count. But
Oh, is
yes,
it
yes,
any,
antibiotic usage. Whenever you take a history, it's very much important that you should, in the last 6 months, was there any history of antibiotic usage or any history of high grade fever which required hospital admissions. But they do return back to normal. In a case of azoospermia where there is zero sperm count, we have seen that they don't respond to medical management, and we also have kind of options to operate them, and of course they don't have any other options like a natural pregnancy. They have to go for an ART or IVF, where we operate on them, take out the sperms, and sperms can be used for an IVF. So it's a holistic approach. So, and if the sperm, if they not respond to medical management, we do operate on a varicocele, we do microsurgical varicocelectomy, which has around 80 to 90% success rate, and the whole effort is to ensure that they try naturally or probably at least an IUI process. I mean, these are the ways we try to approach and treat an infertile case.